Why don't you hold a hand out so you can demonstrate.
All right.
Okay, hi everybody. This is Gene. He's a patient of ours who came in because of dupuytren's contracture, which is when the tendons in the hands shrink. He had surgery for that, and after that, the circulation decreased in his hand, so he couldn't pursue his passion, which is climbing really tall mountains like Mount Everest, because he became so cold sensitive. So we've been treating him for about 6 weeks with a combination of microcurrent and manual therapy. Microcurrent allows us to deliver frequencies into the body specific to tissues, in this case tendons, skin, and muscle. Also conditions affecting those tissues like scar tissue. April, our massage therapist, has been applying the currents along with manual therapy pressure as a way of softening the tissue. The other way we've been treating Gene is with regenerative medicine with prolozone injections, and that's provided by Michelle, our nurse practitioner. The first time Michelle tried to inject his hand, she couldn't get the needle in because the tissue is so tough and fibrous. But then following manual therapy with microcurrent, she's been able to do that, and that has led to even better improvements. So let's get Michelle out so she can bring her needle out and show. She's not actually going to inject it here, but she'll show how she would.
Hello.
Okay, so you can
Hey,
stand.
How are you?
Good.
Good. So since receiving the manual therapy, we've noticed a lot of softening of his skin and tissue. I've actually noticed an increased range of motion. And have you noticed an improvement in your cold sensitivity?
Oh, it's very well. 100% better.
Yeah.
Wow.
Excellent.
110% better.
Excellent.
Before you started this procedure, if I was in temperature zone, say 30, 35 degrees, my hand would get so cold, and the little finger would be discolored because of the low blood flow.
Wow.
So I've tried going up in the 20s for the last couple of weeks. Been up there for 3 to 4 hours each time, and my hand did not have any reaction to the cold whatsoever.
That's awesome.
So you've increased the circulation as good as it used to be.
Awesome. Why don't you show how you would perform the injection?
So usually we perform on the surface of the skin, and you're going to look underneath the surface of the skin and see where the contracture takes place. You just take the needle, and it's filled with prolozone, and it's going to hyperoxygenate these tissues and help the body heal itself. And you're just going to go from a lateral position in about 45 degrees, and it's fairly painless, right? Just a little pinch.
A little bit.
Yeah, not too bad. And he's been tolerating that well, and we're going to continue that for a few more treatments.
Awesome.
Thank you.
Wonderful. Okay, thank you.